you, Dr. Silver. My name is Heidi Mallis. I'm a field epidemiologist with the Maine CDC. I'm actually based here in Lewiston, just off of Main Street, in the DHHS building. And my role is to investigate cases and outbreaks of notifiable conditions in Androscoggin, Franklin, and Oxford counties. So that consists of things like cases of salmonella or outbreaks of flu. Recently, I've been really busy with rabies. Because rabies is endemic here in the state. Lots of rabid animals and exposures there. Certainly also lots of chicken pox at schools. So that's my primary role. Certainly another part of my role is doing outreach, community health fairs, different things like that as well. So I'm happy to answer any questions that you might have as well. But
would it be useful for us to talk about how we got into public health and that kind of thing?
Absolutely. The trajectory is excellent.
Sure, yes. Yeah, absolutely. So I am originally from Phoenix, Arizona. I received my Master's of Public Health degree from Tulane down in New Orleans. I did some health education work for a few years with a nonprofit in Washington, D.C., and then ended up here in Maine. I really wanted to work for a state health department, and what attracted me to Maine was that we don't actually have local health department structure. We have a very centralized health department, and so I have an opportunity to work at the state level, but to do a lot of the local work, to do the community outreach, to work in small rural towns, to do health education, and that's a big passion of mine. So that's how I got into it initially.
So I'm Mary Kate Appicelli. I work for Maine CDC, and Heidi and I both work for the Division of Infectious Disease. And I work under that. I work in HIV, STD, and viral hepatitis. And my job is, so in government there's long titles and long identifying agency titles. So my title is Adult Viral Hepatitis Prevention Coordinator. And what that involves is I have several different roles regarding preventing and controlling viral hepatitis in the state of Maine. One of the things that I do is called surveillance, and so Heidi referenced reportable conditions. In the state we have, there's about 70 what are called reportable conditions. So that means that if somebody tests positive for a condition like she mentioned salmonella, or in my case hepatitis, that healthcare providers are required and laboratories are required to report that to the state. So then when the reports come in, some of the diseases we do active follow-up, and that's regarding preventing new cases of that particular infectious disease, and stopping this, controlling in the sense of helping the people who have the infectious disease to seek care and treatment, or in the case of rabies, you could get something called post-exposure prophylaxis. So you get some shots that would hopefully prevent you from contracting rabies. And so for hepatitis, what I do is I do some of those investigations. So if somebody tests positive for hepatitis C, for example, for some cases I follow up and interview the patient about questions regarding their risk history, medical procedures, their laboratory work, etc. And then we have to report this to federal CDC in Atlanta. And then we keep data on that so we can report out the disease burden in the state, and we look at demographics, like how old the people are who are most affected, where they live, things like that. So I keep that database, and so that's sort of surveillance and epidemiology. And I know that epidemiology is a key piece of this, and maybe Brenda will talk a little bit more about that, or I can, whatever. Okay. So another thing that I do is education and training. So there's a real lack of awareness of viral hepatitis in the state and also nationally. So I do educational awareness campaigns or presentations to people who are at risk for viral hepatitis A, B, or C, and also healthcare providers or people working with folks who are at risk or infected with these conditions. And then I also work on interventions. So an intervention is something that you would do, there's called primary prevention, which is you want to develop programming to prevent people from contracting these particular diseases. And then a secondary prevention would be helping them to learn that they have these infections so they can take steps to seek treatment or learn how to prevent the spread to other people. So I have set up, we have 21 places around the state where we offer free adult hepatitis A and B vaccine. And that involves working with folks like corrections and substance abuse treatment facilities and family planning, among others. And then also places where people can get tested for hepatitis C. So that's kind of this program management component of, and that involves a lot of the same kind of things I was talking about. So is this helpful? Is this the kind of stuff? I don't want to be too technical for you guys, but also doing some education about public health. So my background is I had an undergraduate degree in English, and I did do some minors in social behavioral sciences. That was a real interest of mine. And then I worked for a little while doing some college admissions, actually, for a university that was really diverse. It was in an inner city, and there were people from all over the world, along with kids from the inner city there. And it was really interesting for me to see how a lot of the health and sort of social behavioral issues were impacting kids' ability to focus on what was the reason for being in school, which was the academics. And so that's kind of where I really started thinking about public health. And then I went to, I did a year of volunteer service in Alabama, in a very rural part of the state, and I had the opportunity to do some teen pregnancy prevention in the schools, and also child abuse prevention, and also working with foster kids and teaching them some independent living skills. And so that was like more of this like public health type work. And then I realized that I wanted to pursue a degree. I did some research work in between there, and then I applied to graduate school in North Carolina. And then I came to Maine because I did a fellowship after CDC, at US CDC, which is really for folks who are master's prepared, but it's something that is a really great training program. There are programs for people who have a bachelor's as well through the CDC, and that's how I came to Maine, is to do field work on hepatitis.
Great. Go ahead. Well, I'm Brenda Joly, as Mark indicated. I'm teaching the Introduction to Public Health course, and two of my students are here. This is great. I love when I get the opportunity to talk with people who are interested in the field of public health.